For our final presentation for radiation biology, I chose to look into the subject of neuroblastoma. So some learning objectives for this PowerPoint are for the listener to understand what anatomy or anatomical features neuroblastoma may affect, understand what a neuroblastoma is or what neuroblastoma is in general, learn about the symptoms and procedures regarding a neuroblastoma, discuss the treatments and future implications involving neuroblastomas, and review a case study of a patient inflicted with neuroblastoma. So the anatomy involved, you have your nervous system. The nervous system is the conducting system of messages between the brain and the body. This has many different branches and divisions, as we all know, from anatomy and physiology, brain to the body, body to the brain, all of that. I just put some examples of sympathetic, parasympathetic, afferent, efferent. Another area that may be affected by neuroblastomas is the adrenal glands. These will produce important hormones that play a role in controlling heart rate, blood pressure, blood sugar, and how the body may react to a stressor or outside stress. So what is a neuroblastoma? Well, best definition that I could find that I wholeheartedly agreed with was that neuroblastoma is a type of cancer that forms in nerve cells called neuroblasts. That's why it gets the name neuroblastoma. So neuroblasts are immature nerve cells. They normally turn into working nerve cells, but in neuroblastoma, they form a tumor. So neuroblastoma may begin in adrenal glands. That's a more common one. It can also start in the neck or chest area and in the spinal cord, as that obviously has a lot of nerves running through there. So what populations or people might be affected by this disease? So neuroblastoma is the second most common infant and childhood tumor in the world. This tumor can develop in early childhood, and they've even seen ones that develop while the baby's still in the womb or just before birth. So these are due to a genetic mutation. Most causes of these mutations being unknown. They found some where it's something in the genetic code of the parent, and then that will then translate to the child getting these mutations and then subsequently a neuroblastoma. So what are symptoms of this neuroblastoma? Well, you might see a palpable lump in the abdomen, neck, or chest, bulging of the eyes, dark circles around the eyes. Might even see bone pain. This is normally in the spine. Swollen stomach and trouble breathing in babies. So, you might see swelling of the stomach if, the tumor's on the adrenal glands. It can kind of displace things, which displaces really everything in the abdomen. Painless, bluish lumps under the skin in babies. And then weakness or paralysis, loss of ability to move a body part. So this can even go to the degree of, say they have spinal pain, translates to the hips, and eventually the patient can't even really walk effectively. So how would someone be diagnosed with neuroblastoma? Well, you review their medical history and even family history, but that's not entirely common just because, like I said, it's a low rate of the mutations being family. You could have a mixture of imaging tests. So it's not normally just one test. It's going to be multiple. These can vary from CT, MRI, MIBG scans. They could have a neurological exam, blood, and or urine tests, and they could even have a possible biopsy. This could be from where the neuroblastoma is, or a general area could be like the lower lumbar of the spine, and they just take a biopsy from there and see what the cells are like there. So imaging, again, commonly done as a CT, MRI, or even MIBG scans. The results of these, you normally see a large, lobulated, heterogeneous solid mass that may even displace adjacent organs. So the radionuclides that are used in imaging, you have your technetium-99M, MDP or HDP for bone imaging, your indium-111 octreotide for an octreotide scan, fluorine-18 FDG for PET-CT imaging, and then for the MIBG scans that I've been mentioning, you might see I-131 or I-123. So what are the different stages? Well, they go from 1 to 4S. They increase in severity as you go higher in the numbers. So stage 1 is just localized tumor, with or without microscopic residual disease, and you have negative tests on your bilateral lymph nodes. Your 2A, unilateral tumor, incomplete resection, identical bilateral lymph nodes are still negative. 2B, still unilateral tumor, complete or incomplete, and you might see some differences in your lymph nodes now. 3 is crossing the midline with or without positive regional lymph nodes, still a unilateral tumor, positive contralateral regional lymph nodes, and positive bilateral regional lymph nodes. 4, you're looking at metastases or metastatic disease to distant lymph nodes, bone marrow, liver, and other organs, except as in 4S. So 4S is a stage 1 or stage 2 primary tumor. So that just means it starts where it is, with metastases limited to the liver, skin, and bone marrow. And these are normally in a child of 1 year. So as I said, 1 to 4, 1 being least progressed, 4 being most or worsened condition. So what are the treatment options for neuroblastoma? Well, you have surgery, you just remove it. Radiation therapy, chemotherapy, so those are common in really any cancer form. One that I found was interesting was high-dose chemotherapy or radiation therapy with stem cell rescue. So this differs from your normal radiation or chemo because you're using a higher dose. So that higher dose is going to be more effective at obliterating these cells. However, it also is going to affect your normal cells. So they give stem cells to heal and replace these cells. That's why it's a stem cell rescue. There's also targeted drug therapy, which is using drugs in a targeted manner, as the name says, at the neuroblastoma area. So an example of a case where a patient did have a neuroblastoma, you have a 5.5-year-old male patient complained of persistent back pain with worsening pain for the previous 3 months. The imaging that they did, you had a bone scan with Tech-99M MDP, followed by an octreotide scan with indium-111 octreotide. The results of this were increased uptake that really showed metastases, and then they did a biopsy as well, confirming metastatic neuroblastoma. So What are some future implications? Well, as I've said, neuroblastoma is it's relatively unknown. So the causes, like I said, are unknown. Only 1 to 2% of patients receive genetic mutations from their parents for specifically neuroblastoma. Advancements for treatment are currently being researched for this disease as it's unknown. The new treatment, one of the new treatments anyway, that I found was immunotherapy, which is a newer treatment for more than just neuroblastoma, but it did apply to this. And it's specifically using child immune system because that's where neuroblastoma commonly is. And you're kind of amping up this immune system or stimulating it. The example that I found was macrophages to destroy and get rid of these mutated tumor cells. So thank you. That's really all I have on neuroblastoma. I hope this was helpful. And those are my sources.